Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaz. Every Friday, Saturday, we will have a subject-wise mock test according to the schedule. I left the schedule below. Be part of our WhatsApp study group. The moment class is about to start, we will send you a feeler and the YouTube link. And also the question paper for you to solve. We'll send the PDF. Nice to see Motis Kumar and many more who are all online. Good. Can you please punch the voice loud and clear, Dr. Kumar? So every Sunday we have a full-scale mock test. 200 MCQs with 160 clinical minute-based questions and 40 image-based questions. Thank you, Motis, for the feedback. So Monday to Thursday, we will have one subject we'll pick up, and there will be around 5,000 short sentence tweeters. They're called tweeters for a rapid revision. I'll give you the ebook PDF. We will do the revision. So with this preamble, let's make the great beginning, Doctor. And before we start, let's have a quick commercial. Good. So welcome back. Can the students can punch? Is the voice loud and clear for all of you, Doctor? Yeah. So yes. Now. So in the anatomy, today's mock test, subject-wise mock test, we have 200 MCQs. As many questions I can in 1 hour, we will do the revision, and remaining, you have it all available in the ebook, PDF, all the solutions. 45-year-old with chest pain, ST segment, elevation and inferior leads. There's an inferior wall MI, and inferior wall is mainly made up of what? The inferior diaphragmatic surface of the heart, 2/3 is by the left ventricle and 1/3 is by the right ventricle, is what you should remember. 50-year-old women presents with chest pain, worse with deep inspiration, improved by sitting forward, recent upper respiratory infection. So this is typical of pericarditis, which involves fibrous pericardium, parietal pericardium, and epicardium is what you need to remember. 38-year-old, sharp chest pain that worsens when lying down, improves when sitting up. Always when you listen that, remember that we are talking about pericardial pathology. There is a pericardial friction rub. Echo shows fluid in the space. So where is this pericardial effusion located? Between the epicardium and the parietal pericardium, you have the pericardial effusion. 65-year-old with a history of pericarditis. Which nerve transmits the pericarditis pain? It is the phrenic nerve, which is the one which transmits. 30-year-old with sudden onset of sharp chest pain radiating to her left shoulder neck. So the pericarditis pain, typically referred pain to the neck, arms and shoulders, often to the left side, is what you need to remember. That pain is typically sharp and it is pleuritic and it worsens with the inspiration and lying down and improve when you sit or lean forward is what you should remember. A 55-year-old man with acute onset of the chest pain, his ECG show in V1 to V4. What is V1 to V4? Anterior precordial leads, V1 to V4. V1 is on the right side, V6 is on the left side. V1 to V4 is typically anterior, V5, V6 is called lateral, is what you should remember. So V1 to V4, ST segment elevation is there. That means it is an anterovolemi most commonly because of the left anterior descending artery occlusion, which is called the widow's artery, is what you should remember. 60-year-old with hypertension, ST elevation anterior leads. It is the left anterior descending, most common to get affected in the anterovolemi. 70-year-old inferior volemi. There's a blockage in the coronary artery which is supplying the posterior part of the interventricular septum and the posterior walls of the ventricles, which is the typical territory of the posterior descending artery. Posterior descending artery. So when do you call right dominance and left dominance, doctor? Whenever we talk, right dominance and left dominance of the coronary artery. Right dominance means right coronary artery is giving origin to posterior descending artery. Left dominance means posterior descending artery is arising from left circumflex artery. Right dominance, left dominance is what you should basically remember. 65-year-old with a history of coronary artery disease with syncope, palpitations. There is a blockage of the artery supplying the AV node, SA node. It is the right coronary artery that supplies the AV node and SA node is what you should remember. 55-year-old with chest pain, right ventricular infarction. So which artery supplies the right ventricle, doctor? It is the right marginal artery that supplies the right ventricle is what you should remember. A 45-year-old, history of hypertension, hyperlipidemia, atherosclerosis in left coronary artery. Now the question is, which phase of the cardiac cycle does coronary blood flow to the left ventricle and interventricular septum will peak? It is the early diastole. Early diastole, during which major part of the coronary blood flow will flow, is what you should remember. That's the reason if you slow down the heart rate, if you increase the diastolic filling time, then there is an improved coronary blood flow, is what you have to basically remember. So Raj is saying, sir, why did not you join some apps like Cerebellum, Prepladder, DAMS? Your teaching is good. Thank you, Raj, for the compliment. Past 25 years, when there was no Cerebrum or Cerebellum or any ladder or DAMS or DAMS or anybody, there was only Bhatia in the North India. In South India, Dr. Murali Bharadwaz. So there is an app called Score Learning app that we ourselves have, and there is about 300 hours of video content. So you get it as a compliment when you join our program. But we enjoy more, almost 3 lakh medical students every year, 10,000 to 15,000 students across last 25 years have been attending free YouTube session, and we still have a paid program in addition to these free classes where you get 155 ebook PDFs, Dr. Raj. Now, but Always teachers like us love compliments. So when you say, sir, aapka class maza aa gaya, whenever a student says, teacher is also happy. Teaching, like surgery, is an inborn error of metabolism. It should come within like a passion. So we are very passionate to be surrounded by the students. So please like this video, share this video in all your social groups and tell your friends. By Dr. Murali Bharadwaz bolke MD, General Medicine Physician, 25 years में 3 लाख डॉक्टर्स को इंस्पायर किया है, right? Joshua is asking, sir, is there any schedule for NEET 2024 August session? So August is like a unexpected delayed pregnancy, Joshua. So every day we have a class. Monday to Thursday there is a subject-wise discussion. Every Friday, Saturday is a subject-wise mock test and discussion. Sunday full-scale grand test. So 6 months program abhi chal raha hai. So just enjoy attending. Once entrance is over, if you still feel you are going to go for the next exam, then definitely be part of our 6 months program. So, doctor, continuing our journey, let's go to the next question. All these questions, be part of our WhatsApp study group. So that before the session starts, I'll post this PDF so that you can solve the paper and attend the discussion. Maza aayega. Which structure involves the draining of the blood from the coronary circulation into right atrium? It is the coronary sinus which runs in the left anterior atrioventricular group. Left anterior descending artery runs in left AV group. Even coronary sinus runs in that and drains the deoxygenated blood from the coronary circulation into the right atrium. 60-year-old man with a history of MI presents with bradycardia, hypotension, posterior descending artery arising from the right coronary artery. So whenever posterior descending artery arises from right coronary, you call right dominant circulation. Whereas if the PDA arises from the left circumflex, you call it as left dominant. And in codominant, it gets contribution from both the RCA and the LCX. LCX is the branch of the left coronary, is what you need to basically remember. A newborn is evaluated for a neck mass. It is located in the midline, moves with swallowing whenever he is protruding the tongue. Classical of a thyroid diverticulum, which arises from the floor of the primitive pharynx and descends into the neck. And the thyroglossal duct cyst will form if the duct does not obliterate, presenting like a midline neck mass is what you should remember. A 5-year-old boy with midline neck mass that moves upwards when he protrudes the tongue. It is present since the birth. Which embryological structure gives rise? So it is the thyroglossal duct which connects the thyroid gland to the tongue. During the development, if it persists, it can form the pyramidal lobe of the thyroid. It can form a cyst, is what you have to basically remember. At what gestational age fetal heart begin to beat? By week 4, 30-year-old woman comes to first prenatal visit at 8 weeks gestation. You told the heart begins to develop early in pregnancy and establish left-right polarity. So when will this left heart left, right heart right will develop? By about week 4 of development is what you need to remember. 28-year-old woman is curious about her baby's heart development. When the heart begins to take its shape, that's called cardiac looping. It begins in week 4 of the development. So because of this looping, there is a correct spatial arrangement of the heart chambers. Atria ke jagah mein, ventricles ke jagah mein, aorta ke jagah mein aake badh jayega. 5-year-old with chronic respiratory infections, situs inversus. Situs inversus. 1 minute, doctor. Now, can the online students can punch is a size of the letters is okay and your visibility is good, voice is good. Please give a feedback because I'm deliberating this session from the home. Sometimes internet will be up and down. I always feel insecure about that. Yes, please punch is the voice loud and clear in the middle. 5-year-old boy with chronic respiratory infections, situs inversus. There's a mutation affecting ciliary dysfunction. So, which condition is that? It is the cartaginous syndrome where you see dextrocardia, which is due to ciliary dysfunction. Quickly tell me, doctor, Marfan syndrome, MVP, Turner syndrome, coarctation of aorta, Downs syndrome, atrioventricular septal defect is what you need to basically remember. A newborn is diagnosed with ASD. During fetal development, a structure grows towards the endocardial cushions, initially narrowing the communication between the atria. So what is that structure, doctor? Septum primum grows towards the endocardial cushions, narrowing the ostium primum is what you should remember. A pediatric cardiologist is explaining development of atrial septum. The formation of a secondary opening in the septum primum occurs because of the programmed cell death. What is this second opening called as? Ostium secundum forms in the septum primum because of the cell death, and it will allow the continued blood flow between the atria as the ostium primum regresses is what you should remember. A neonate is evaluated for the heart murmur. Echo shows patent foramen ovale. So, if you look at septum secundum, it is the structure that develops on the right side of the septum primum and it maintains the right to left shunt is what you have to basically remember. A 1-year-old has patent foramen ovale. And what is that fetal structure, doctor? The septum secundum expands and covers most of the ostium secundum, forming the foramen ovale. And this structure is needed in fetal circulation to allow the blood to flow from right atrium to left atrium, bypassing the lungs, is what you have to basically remember. A newborn has congenital heart defect involving the atrial septum. This defect is involving a structure which acts like a one-way valve for the foramen ovale. Which structure forms this one-way valve? It is the septum primum, which forms the one-way valve of the foramen ovale. This valve will allow the blood to flow from the right atrium to left atrium during fetal development, but prevents backflow after the birth. When the pressure in the left atrium increases, right atrium decreases, it will prevent the backflow after the birth. That is the function of septum primum. A newborn undergone echo. So there's an increased pressure in one of the atrium which causes the septum primum to close against the septum secundum. So it is the left atrium which has an increased pressure that causes the closure. A 3-year-old, there are two structures that fuse to form a complete atrial septum. Which structures they are, doctor? Septum primum and septum secundum. A 5-year-old has ASD. It is the septum primum and septum secundum which fuse would their failure to fuse lead to ASD? 60-year-old with stroke, there's a paradoxical embolus passing through patent foramen way. What is the cause of the defect? Once more, it is the failure of the septum primum and septum secundum to fuse that lead to ASD, that lead to paradoxical emboli is what you need to remember. So what is called paradoxical emboli? Whenever the blood clot passes from the right atrium into the left atrium and then into the systemic circulation. Right atrium to left atrium, into left ventricle, into aorta, into systemic circulation. That is called paradoxical emboli, which you see in case of ASD, is what you need to remember. A newborn undergoes echo because of a heart murmur. So, the muscular interventricular septum, it forms first. It will leave the interventricular foramen open. The aorticopulmonary septum then rotates and fuses with the muscular ventricular septum, which lead to the closure of the interventricular septum, completing the separation between left and right ventricles completely is what you need to remember. So now, a VSD, why does it happen? Whenever there is any defect of the rotation and fusion of this aorticopulmonary septum with the muscular ventricular septum, which is needed to close the interventricular foramen, then the VSD will result is what you need to remember. Now, it is the growth of the endocardial cushions which separates the atria from ventricles and contributes to the atrial septation and also to the membranous part of the interventricular septum. And any defect of these endocardial cushions will lead to the development of atrioventricular septal defect and associated valve abnormalities is what you should remember. A newborn has a heart murmur, defect in membranous part of interventricular septum. It is the most common abnormality, anomaly of all congenital heart disease, VSD, which typically happens most commonly not in the muscular but membranous part of the interventricular septum is what you need to remember. A 3-day-old infant has cyanosis. There is a abnormality in the formation of the aorticopulmonary septum. It has led to single arterial trunk, aorta, pulmonary artery together. That's called persistent truncus arteriosus is what you need to remember. So, a newborn with cyanotic heart disease, right ventricular hypertrophy, overriding aorta, VSD, pulmonary stenosis, what is that abnormality called? Tetralogy of Fallot. A neonate has a congenital heart disease involving aortic and pulmonary valves. These valves originate from where? They originate from the endocardial cushions of the outflow tract is what you should remember. Epstein's anomaly, what is it? It is the displacement of the tricuspid valve towards the apex of the right ventricle. Tricuspid is there between atrium, right ventricle. Whenever this tricuspid valve is displaced towards the apex of the right ventricle, it leads to atrialization of a portion of the right ventricle and impedes the right ventricular function. That is the problem in Epstein's anomaly. So Epstein's anomaly, you need to remember one favorite point of the examiner. Intermittent cyanosis. It is not continuous cyanosis. Intermittent cyanosis is the classical feature of the Epstein's anomaly. A newborn imaging shows abnormality involving the maxillary artery. Maxillary artery is the artery of the first arch, first aortic arch. Patient has an anomaly of common carotid artery. It is the third aortic arch that gives rise to common carotid artery and the proximal part of the internal carotid artery. Patent ductus arteriosus. Ductus arteriosus normally closes after the birth, becoming ligamentum arteriosum. It develops from the sixth aortic arch, is what you need to remember. And what does ductus arteriosus connect? It connects the pulmonary artery to the descending aorta during the fetal development, is what you should remember. A neonate is diagnosed with a condition that is connecting ascending aorta and pulmonary trunk, which embryonic structure gives rise. So it is the truncus arteriosus that gives rise to the ascending aorta and pulmonary trunk, which is important for separating systemic and pulmonary circulations. 3-day-old infant has a heart defect affecting the smooth part of the left and right ventricle, which embryonic structure is responsible for forming this region. It is the bulbus cordis. Bulbus cordis forms the smooth part of the left and right ventricles, which are essential for directing the blood flow from the ventricles into the major arteries, is what you need to fundamentally remember. A neonate has a congenital heart defect involving trabeculated part of the left and right ventricles. What do they give rise to? It is the primitive ventricle. Trabeculate part is formed from primitive ventricle, and they are important for the contractile function of the ventricles. There is an ASD involving trabeculated part of atria. They are formed from primitive atria. A neonate has a heart defect affecting coronary sinus. It is the left horn of the sinus venosus that gives rise to the coronary sinus. A 1-day-old undergone echo has an abnormality in the smooth part of the right atrium. So it is the right horn of the sinus venosus. The smooth part of the right atrium is derived from right horn of the sinus venosus, is what you should remember. There's a congenital defect involving atrial septum and also AV valves, both of them. That means it is arising from endocardial cushion defect. A newborn has a defect involving SVC. SVC originates from right common and anterior cardinal vein. Anterior cardinal vein and the right common vein. A neonate has a defect affecting IVC. IVC arises from posterior, subcardinal and supracardinal veins. And these veins are essential to return the deoxygenated blood from the lower body of the heart. Smooth part of the left atrium typically is derived from the primitive pulmonary vein. The neonate's umbilical vein is tested. Umbilical vein mein what is the oxygen saturation? 80%. Umbilical vein is oxygenated, umbilical artery is deoxygenated, is what you need to remember. So blood in the umbilical vein has PO2 of 30 millimeters mercury and 80% oxygen saturated. So umbilical arteries carry deoxygenated blood from the fetus to the placenta and typically have low oxygen saturation around only 40%. What is the shunt during embryonic life that allows blood to bypass the liver and go directly to the inferior vena cava? It is the ductus venosus, one of the 3 fetal shunts that allow the blood to bypass the liver and flow directly into the IVC, is what you should remember. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Yeah? Good. 30 minutes में 50 runs खत्म कर दिया. Good, good, good. A quick break with the commercial about our 6 months NEETPG coaching program. I'll rejoin you. So welcome back to the session, Doctor. Good. A newborn has a respiratory distress, which fetal shunt allows the blood to flow from the pulmonary artery to the aorta bypassing the lungs, ductus arteriosus. What physiological change at birth lead to closure of the foramen vein? With birth, there is an increased left atrial pressure, same time decreased pulmonary resistance because of the lungs open up. Oxygen levels in the alveoli increase, which lead to pulmonary vasodilation, leading to decreased pulmonary resistance, same time increased left atrial pressure, lead to the closure of the foramen vein, is what you should remember. So, what physiological factors contribute to the closure of the ductus arteriosus after the birth? It is the high oxygen and low prostaglandins. High oxygen, because lungs open up after birth. High oxygen, low prostaglandins that close the ductus arteriosus. Which medicine is used to maintain the PDA or close the PDA? NSAIDs such as indomethacin are used to close the patent ductus arteriosus. Which medication maintains the patency of the ductus arteriosus? It is the prostaglandin E1 and E2 which maintain the ductus arteriosus, is what you need to basically remember. So if you look at the PDA, the ductus arteriosus becomes ligamentum arteriosum, is located very near to the left recurrent laryngeal nerve. Especially whenever you are operating on the PDA, you need to be careful with left recurrent laryngeal nerve, is what you should remember. A neonate diagnosed with an anomaly involving ligamentum venosum. So the ligamentum venosum is the remnant of the ductus venosus, which is a fetal shunt that allows the oxygenated blood from the placenta to bypass the liver and flow directly to the inferior vena cava, is what you should remember. A neonate undergoes the echo that shows fossa ovalis in the atrial septum. Which fetal structure? Fossa ovalis originates from foramen ovale. There is a midline abdominal mass. Imaging shows it derived from allantois. So the allantois develops into urachus, which later become median umbilical ligament, not medial, median umbilical ligament. And this structure is a fibrous remnant, which is located in the anterior abdominal wall, is what you need to remember. Can the online students once more punch? Joshua and others, is the voice loud and clear for all of you, doctor? Now, the umbilical arteries become medial. Umbilical arteries become medial umbilical ligament after birth, is what you need to basically remember. A one-day-old infant is examined. The umbilical vein is identified. What will umbilical vein will become? Ligamentum teres hepatis. This structure is located in the falciform ligament and is the remnant of the fetal circulation. So what does umbilical vein did there? Umbilical vein carried oxygenated blood from placenta to the fetus. This umbilical vein become ligamentum teres hepatis and located in the falciform ligament of the liver, is what you should remember. There is mitral stenosis. Patient has dysphagia, hoarseness of all the chambers of the heart. Which chamber is most posterior? It is the left atrium. That's the reason any left atrial enlargement will grow and compress the esophagus, leading to dysphagia, hoarseness because of the recurrent laryngeal nerve which got affected, is what you need to remember. Thank you, Joshua, that the broadcast is clear. Good. So good to see 8 online classmates. So already this subject-wise mock test 1 is uploaded in the learnograph.com. You can go there. You can get the explanatory answers, 200 questions to practice as a mock test. Everything is made available. It's up to you to practice. Always coaching centers data hai. Loads and loads of material will be given by the coaching centers. But can you consume? Is it high yield? Is it focused? Very important. अगर 1 घंटा कोई पढ़ाए तो 5 घंटे पढ़ने, अपने आप पढ़ने का मूड आना चाहिए. So we don't teach, we only inspire you to read, and we will give you the right study material, focused study material, which will actually give you the seat in the upcoming NEETPG, FMG, INI, CET, etc., etc. Malva is asking, greetings sir, what are your daily timings for the YouTube live? See, generally it is the evening hours, because morning I am a very busy clinician. ICU rounds, admissions, OPDs. I also do home health care by visiting the elderly people in the home in Hyderabad. So evening I get time. So please do come and be part of our WhatsApp group, doctor. Please be part of our WhatsApp study group. All right. So I'm posting you the phone number. Okay. If you are not yet part of our WhatsApp study group, please be part of the WhatsApp study group. You can call either Mary or Bhagya, who will help you to be part of the WhatsApp study group. Right? Yeah. So sometimes if I get time, I'll try to join much early. Monday to Thursday, one subject, quick revision, and I'll give on each subject around 5,000 single liners for rapid revision. All right. In the learnograph.com, the PDF is available. Anatomy, physiology, all 20 subjects. Then Friday, Saturday will be subject-wise mock test and discussion. Before only, I'll post the PDF of the subject-wise mock test in the WhatsApp study group. Please be part of it. All right. And we'll have a discussion. Every Sunday, I'll give you 200 MCQs. Around 160 MCQs are clinical vignette-based questions, just like the NEETPG exam. And 40 questions are image-based questions and discussion. So totally 200 questions. I'll give you the full-scale mock test on every Sunday. It is also made available as a PDF on the learnograph.com. So I don't give that flashy, your rank all India is this much, your chance of getting seat is that much. Bolke, jaise a lot of apps give, I don't do that. That only discourages you. Out of 200 MCQs, if 160 MCQs you are able to do correctly in Dr. Murali Bharadwaz mock test, you are already on a winning path. No need of comparing with anybody. So that is the reason what you do, whatever the PDF I share in the WhatsApp study group, share with 3 to 4 of your friends. All of you see, do the mock test and solve it, and then come for the discussion. And you can also download the ebook PDF of explanatory answers of the mock test from the learnograph.com. So very nice to see. We have about a group of 15 students just now downloaded, purchasing the subject-wise mock test of this anatomy on the learnograph.com. So you can go and download, and if every PDF to download is becoming costly for you, please call our helpline and we will give you it like a package. 155 ebook PDFs, 190 hours of live class to stimulate your preparation. It includes 10,000 PYQs of the NEETPG past 10 years. Everything is being included in the package for you. So, doctor, continuing our discussion, let us remember 5-year-old midline neck mass, swallowing on tongue protrusion. This we already discussed, thyroglossal duct, right? Now, a newborn has a neck mass suspected to be thyroglossal duct cyst, and there are thyroid follicular cells in the cyst. From where are they derived? They are derived from the endoderm. Thyroid follicular cells are derived from endoderm. Parafollicular cells are called C cells. They arise from the fourth pharyngeal pouch is what you need to basically remember. What are the hormones produced by the anterior pituitary? FSH, LH, ACTH, TSH, prolactin, growth hormone, and beta endorphin. They're all the ones which are being produced. So which intermediate low hormone lead to hyperpigmentation? Melanocyte stimulating hormone is derived from the intermediate low. From the oral ectoderm, there is a pituitary adenoma which is developing. So anterior pituitary is developed from the oral ectoderm, specifically as an invagination of the Rathke's pouch. And tumors originating from this are called adenomas, Rathke's pouch, and can affect the secretion of anterior pituitary hormones is what you need to remember. It is the beta subunit that gives hormone specificity for TSH. Otherwise, TSH, LH, FSH, and HCG, all of the alpha subunit is common. Only beta subunit will bring the specificity. So, from there is the ACTH, beta endorphin, melanocyte stimulating hormone, all of them originate from the pro-opiomelanocortin is what you have to remember. A 50-year-old with fatigue and weight gain and blood tests show low TSH, low T4, indicating secondary hypothyroidism. So, from which cells TSH come? They come from basophils. Basophils in anterior pituitary produce FSH, LH, ACTH, and TSH. You can remember it as B flat. Whereas acidophils secrete prolactin and growth hormone is what you have to basically remember. Now, doctor, a patient with polyuria, polydipsia, posterior pituitary mass, from where is it derived? It is derived from neurectoderm. It produces posterior pituitary stores ADH and oxytocin and releases them. From which embryological layer adrenal cortex is derived, doctor? From the mesoderm. Whereas the adrenal medulla arises from neural crest cells is what you should remember. So it is the beta cells that produce the insulin, alpha cells produce glucagon, and delta cells that secrete somatostatin is what you need to remember. Now, abdominal pain, jaundice is there in a patient. There is a mass at the level of ampulla of matter. So, you need to remember the foregut may esophagus duodenum is there up to the level of the ampulla of matter. And this region also has liver, gallbladder, pancreas, spleen. All of them are supplied by celiac artery, which is the main blood flow to the foregut is what you need to basically remember. So, doctor, this session looks very fast, right? It looks very fast if you have not solved the question paper and came to the session. It looks very slow and okay if you have solved the paper and came. So be part of our WhatsApp study group, right? You can call Mary or Bhagya, who will help you to get included into the WhatsApp study group. We post the PDF, which is put for discussion. We post the PDF which is put for discussion. So solve the paper, share it to 4-5 friends, all of you sit together, have a Zoom call and then have a discussion on the question paper and then come for this discussion. Tab aapko maza aayega. So that is how you need to prepare for the exam, doctor. A 6-year-old boy with abdominal pain and vomiting. Imaging shows mass in the lower abdomen. So the midgut extends from lower duodenum to the proximal 2/3 of the transverse colon, which is supplied by superior mesenteric artery and is prone to anomalies like malrotation. Imaging show a mass in the distal third of the transverse colon, which is the part of the hindgut. Hindgut extends from distal third of transverse colon to the upper part of the anal canal above the pectinate line and supplied by inferior mesenteric artery. Inferior mesenteric artery. And hindgut in में क्या क्या होता है? Descending colon, sigmoid colon, and rectum is what you should remember. A neonate has abdominal distension, bilious vomiting, malrotation. So, during which weeks of development intestines herniate into the umbilical ring and return to the abdominal cavity? So, during the 6th week of development, midgut herniates to the umbilical ring and returns to the abdominal cavity and rotates by the 10th week is what you need to basically remember. A neonate has a sternal defect, exposed heart tissue, ectopia cordis, and this is because of what? It is the rostral fold closure defect that lead to sternal defects like ectopia cordis, where the heart is partially or completely outside the thorax, is what you have to basically remember, doctor. Very nice to see a group of 10 students have just now purchased this anatomy subject-wise mock test from the learnograph.com. Good. So a newborn has abdominal wall defect. Intestines are protruding. It is covered by the sac composed of peritoneum and amnion. What is your diagnosis? Omphalocele. Omphalocele may the contents herniate through the umbilicus, covered by a sac which is composed of peritoneum and amnion. It is the failure of the lateral fold closure during the development that lead to the development of the omphalocele. Maldevelopment of the omphalocele is what you should remember. There is a defect in the lower abdominal wall causing bladder extrophy. It is due to the caudal fold closure defect, which lead to the development of the bladder extrophy is what you need to remember. A newborn has a defect in abdominal wall where intestines are protruding, not covered by peritoneum or amnion. That is classical of gastroschisis. Gastroschisis. It is not associated with any chromosomal abnormalities and generally has a good prognosis. A newborn with gastroschisis require immediate surgical intervention. So what is true about it? It is not associated with any chromosomal abnormalities unlike omphalocele is what you need to remember. With regard to the omphalocele can be associated with chromosomal abnormalities like trisomy 13, Edwards syndrome, trisomy 18 is what you need to remember. A newborn has an omphalocele with Beckwith-Wiedemann syndrome. So omphalocele can be associated with trisomy 13, trisomy 18, Beckwith-Wiedemann syndrome, structural problems of the heart and other organs is what you should remember. A 3-month-old has umbilical hernia that protrudes during crying. The hernia is covered by the skin. It is present since birth. What is this condition, doctor? Basically, a congenital umbilical hernia is the failure of the umbilical ring closure is what you should remember. A neonate has umbilical hernia protruding when crying. So typically Down syndrome, trisomy 21 children have congenital umbilical hernias. A neonate has drooling, choking, and vomiting with the first feeding, and there is a air in the stomach. So whenever there is an esophageal atresia and the distal part of the esophagus is directly connected to the trachea, that is distal esophageal fistula along with esophageal atresia, which is the most common type of tracheoesophageal fistula, then you will get air in the stomach because distal esophagus is connected to the trachea. So the air through the nose goes into trachea, from the trachea to the distal esophagus goes into stomach, even though the upper part of the esophagus is closed as a esophageal atresia. A newborn has cyanosis, respiratory distress immediately after the birth, history of polyhydramnios, drooling of the saliva, inability to pass nasogastric tube. This is a classical example of esophageal atresia, is what you need to remember. A neonate has history of drooling and choking. What is the next important step that you need to do? You need to do the chest X-ray and check for the air in the stomach. If there is air in the stomach, there is also tracheoesophageal fistula. Otherwise, it is a isolated esophageal atresia. Only if it is isolated esophageal atresia, no tracheoesophageal fistula, then you don't get air in the stomach. If there is air in stomach, means it is not just esophageal atresia, but distal esophagus connected to the trachea, and there is a esophageotracheal fistula, is what you need to remember. There is a gasless abdomen, newborn with drooling and choking with feeds. Then it is a pure esophageal atresia, no tracheoesophageal fistula if there is no gas in the stomach and it is a gasless abdomen, is what you need to remember. A one-day-old infant with bilious vomiting, abdominal distension. Mother says he did not pass the meconium. What is your diagnosis, doctor? It is duodenal atresia. Duodenal atresia presents with bilious vomiting. Bilious vomiting, because second part of duodenum only ample of water will open now. So duodenal atresia presents with bilious vomiting, abdominal distension within the 1 to 2 days of life. Double bubble sign typically is a feature of duodenal atresia, which is seen in trisomy 21, is what you should remember. A newborn has jejunal atresia. What is it because of? It is the disruption of the mesenteric vessels leading to ischemic necrosis that lead to the jejunal and ileal atresias. Triple bubble sign and gasless colon is equal to jejunal and ileal atresia. 3-week-old non-bilious vomiting, palpable olive-shaped mass in the abdomen, is hypertrophic pyloric stenosis, is what you should remember. So what is the alkaline disturbance you get in pyloric stenosis? Typically it is hypochloremic, metabolic alkalosis due to secondary hyperaldosteronism, is what you should remember. Infant has hypertrophic pyloric stenosis. How do you want to evaluate? We need to evaluate with ultrasound, which is the diagnostic imaging modality of choice. And there is a thickening, elongation of the pylorus, and definitive treatment is Romsted's operation, which is surgical pyloromyotomy in case of congenital hypertrophic pyloric stenosis, is what you need to remember. So that brings us to the end of 100 questions out of 200 questions, doctor. So you need to solve the 200 questions, right? So take the PDF, buy the NEETPG subject-wise mock test 1. Tomorrow we'll have once more anatomy subject-wise mock test 2. Be part of our WhatsApp study group. I'll give you the PDF of the question paper, not key. For key ke liye, you need to download the PDF by paying for the PDF. All right, doctor. And रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके हमारा नंबर आ गया बोल के दुनिया को बताएंगे. Right, doctor? So thank you very much. Please be part of the WhatsApp group. Like this video, share this video on the YouTube, comment If you comment more, YouTube will circulate it more to the other students. Also, please post this video link in all your social media groups. Good night and enjoy the preparation.